Yeah, I'm sorry, it's late by 10 minutes. So once again, welcome to our live session. So in the previous session, we tried to cover all the textbook literature pertaining to this selection of abutment T from present state. And we'll start with the question, unanswered question from the previous session. So you asked me like, what if mandibular canine is missing? So as per the literature, if it can be either maxillary canine or mandibular canine missing. Whenever canines are missing, we take the mesial support not only from the lateral but also from the central, because lateral offers very less perisegmental area or support. So we take the support from the central incisor as well, mesially. And distally, obviously, we take the support of premolar, but mesially we take support of lateral as well as central incisor in case of a missing maxillary canine or a mandibular canine. Right? I hope it's clear, and I also hope it is streaming fine and it's audible. Let me know if you want me to raise my voice further. Yeah, I hope I was audible when I was explaining you that patient, right? So we'll just proceed with the summary in this current video. So we'll discuss the summary and then we'll proceed with MCQ discussion. We have around 11 MCQs, so we'll have a discussion. So to summarize all that we have discussed so far. So as you can see, selection of abutment teeth, we have various criteria. So we have replacing a single missing tooth scenario or a scenario where you need to replace multiple missing teeth, right? So in case of replacing single missing tooth, we have different options. However, there are certain factors which influence the selection of abutment teeth. So in general, whenever you're planning a selection of any abutment tooth, usually when there is a missing tooth, a single missing tooth, then the standard protocol is we go for a 3-unit bridge, right? A single missing unit or a single missing pontic, that is the tooth which is being replaced, and the adjacent teeth. So we go for a 3-unit bridge in case where there is one missing tooth. So it's a 3-unit bridge. So however, there are certain exceptions, like as we discussed, in cases of missing maxillary and mandibular canines, we take the support of 2 anterior teeth. And also remember, whenever trying to have this kind of cantilever support, or especially in cases where you're trying to replace a missing multiple teeth, you need to have support from 2 abutments at the extreme ends of the cantilever bridge, which we'll discuss again later. So as a norm, just remember the fact that whenever there is a single missing tooth, we go for conventional selection of 2 abutment teeth on either side of the missing tooth, and then we go for 3-unit processes. If at all there is a missing maxillary or mandibular canine, owing to the large surface area and the forces they take up because of their strategic position in the oral cavity, we take the support from 1 distal abutment tooth and 2 mesial abutment teeth, which include a lateral as well as central incisor. I hope it's clear, right? And also, as we have seen, cantilever FPDs are those bridges, fixed partial dentures, where the pontic has an attachment only on one side. So it's like only on one side you have this abutment support. So the best example which we can quote is a missing maxillary lateral incisor, where in this case we take the support of canine, right? Maxillary canine. And also we have seen that assessment of abutment teeth is very much essential. We have to evaluate the tooth not only periodontally, but also endodontally. So even the periodontium, health of periodontium is a prerequisite for success of any restoration or for long-term prognosis of a tooth. Obviously, we need to evaluate the tooth even endodontically. So go for punch test, evaluate that clinically, and also observe the periodontium. And most importantly, when you're trying to go for using endodontically treated teeth as abutment tooth, care has to be taken that the tooth has to be in a healthy condition, in the sense there has to be adequate crown and root support. If necessary, we have to reinforce that with post and co, and then go ahead with the procedure accordingly. And also we have unrestored abutments, which are considered as an ideal abutment. So unrestored, caries free, without any restoration. So those healthy teeth are considered to be ideal abutments, right? And also we have this scenario where you can have tilted teeth as well. So in case of tilted teeth, we go for orthodontic uprightening. We can go for prevention of this tilting, and we have various other treatments, right, as mentioned before, which can be done in order to restore the lost space. Or as such, if it is not possible for us to correct the tilt, we can even design a different kind of FPD altogether, where you have this male and female components and different designs of the connectors, right? I hope it's clear. So these are some of the components which fall under when you're replacing a single missing teeth. So we need to consider these factors. Cantilever FPDs, assessment of abutment tooth as usual has to be done in a general case scenario, and endodontically treated teeth, which can also be used as abutments, unrestored abutments, which are ideal abutments, and mesially tilted molars, right? And usually in case of tilted teeth, this tilting can occur because of a loss of tooth. As we discussed, whenever there is a missing tooth and when you don't care to restore it or replace it, so when the patient neglects it, there can be tilting, there can be super-occlusion or supra-occlusion of the opposing tooth, and in the process there can be loss of contacts. So these are very important points pertaining to this particular aspect. And then we have another case where we go for replacement of several missing teeth. And also remember, when you're having this cantilever design, there can be mostly lateral forces acting. If you have this conventional design where you have support from either side of the edentulous space, then most of the forces will go along the long axis, and that will be beneficial. But the challenge with cantilever design is that there can be lateral forces, there can be tipping forces, rotational forces, or horizontal forces acting even on the abutment teeth. And in case of replacing several missing teeth, there can be overload on the abutment teeth which are existing, and also we need to give special consideration when treating patients with parafunctional habits like clenching or bruxing, where there can be abnormal forces acting. And also the direction of forces are important, as we discussed just now. Usually forces acting along the long axis are favorable, in the sense they are readily dissipated in the periodontal bone, and then there will be better response that can be anticipated from an FPD. But as we have seen previously, lateral forces which are seen as a result of this cantilever design can be damaging as such. And most importantly, we have this concept of root surface area. As you mentioned, we have even these values asked in previous sentence questions. So we have these perisegmental area values which give us an idea on deciding the number of teeth which can be used as abutment when you're trying to replace several missing teeth. So in case of maxillary arch, the tooth which offers a very least or very low perisegmental area is lateral incisor, and the tooth which offers maximum perisegmental area with a value of 433 approximately, it's maxillary first molar. In case of mandibular arch, the tooth which offers a low perisegmental area is mandibular central, which is in hundreds place, and mandibular molar, which has a maximum perisegmental area of 431 prox, right? And based on this perisegmental area, root surface area, we have this law given by Antis. So Antis law states that the perisegmental area of the abutment teeth should be equal or even greater than the teeth which you are replacing. That's very important. So that's Antis law for you. And Antis law was not accepted widely later on, and there were reports where the authors have done various clinical studies and proved that even by not following Antis law, they could see that most of the FPDs were of success, and there were even post follow-up after the procedure for around 8 to 11 years, where there was minimal or no attachment loss, provided the care of periodontium is taken care of, like there has been meticulous plug control, a proper oral hygiene being maintained, and also root planing procedures all done. So once the concept is once the health of periodontium is maintained, so it is mentioned that even if you don't follow Antis law, which is not possible in all cases, that there can be a good long-term prognosis of given processes. And we also had a discussion pertaining to that previously in the last session. And role of periodontal disease. So obviously with periodontal disease, the amount of bone is going to get reduced. So the adaptive capacity or the capacity of the periodontium to overcome the forces is obviously going to get decreased, right? So it's mentioned that most of the roots will have conical orientation. So when one-third of bone loss is seen, as in case of horizontal bone loss, more than half of the support is being lost, because in one-third of the root you have more root surface area which is being lost. In the sense, all that is being not useful to provide support to the processes. And on top of it, when there is bone loss, the clinical crown length obviously increases than anatomic crown, and there can be more, even greater forces acting, or even normal forces seem to be greater on that compromised periodontium. So that's pertaining to periodontal disease. So just keep that in mind. And finally, we have a relation between span length and deflection. So it's mentioned that any long span fixed partial denture, it deflects whenever there is some force acting on it. So there is a relation between the amount of deflection and the length of the span of that FPD. So if the deflection, it's mentioned that it is a cube root, or it's mentioned that the deflection is proportional to the cube of the length of the span of the bridge. In the sense, you have this one pontic span. Span in the sense, the length of edentulous area, right? Assume that it's the span or the length of the bridge. So the span of the FPD, it's one pontic, or it can be two pontic. I'm just giving you some examples, or three pontic. So this is the length or span of the bridge. And this is the amount of deflection, right? So as you can see here, in case one pontic is missing, assume that the amount of deflection is x. Two pontics, it will be 2 cube x, which is equal to 8x. If it is 3 pontic, 3 cube x, which is approximately 27, not approximately, but exactly 27x, which means deflection is proportional to the cube of length or the span of the bridge, right? So that's what we have been discussing previously. So deflection is proportional to the cube of the length of the span of the bridge, and this is how we can see the variation accordingly depending upon the span. So obviously, the greater the span of the bridge, the more the deflection is, and that relation is definitely not linear, right? I hope it's clear. So this is the entire summary which I wanted to discuss. So among all these aspects, try to focus on these cantilever FPDs and also mesially tilted molars. And pertaining to this, you have this direction of forces, root surface area, which is very important, and you have this root shape and angulation. I haven't mentioned this, right? So root shape and angulation, obviously, diverging roots, more support than converging or conical roots. And also in case of single-toothed, elliptical cross-section, greater surface area, more support than a conical root. And also, it's also mentioned that we have different other criteria, right? So root shape and angulation also going to play a role in selection of abutment teeth, right? So among all this, try to focus on these particular points, right? Periodontal disease is already obvious. So focus on cantilever FPDs, mesially tilted molars, direction of forces, root surface areas, root shape and angulation, and span length, right? So that completes our summary. So you have any questions? I'll just wait for 2 minutes. You can just post your questions, and then we'll proceed with MCQ discussion, right? Yeah, diverging roots offer better support than converging roots. Elliptical cross-section of a single-rooted teeth offers better support than a circular cross-sectional single-rooted tooth, and a well-aligned tooth offers better retention than a tilted tooth. Right? That's pertaining to your root shape and angulation. It's relative. What about curved root in the sense? Can you just complete your question for him? You're talking in terms of support? Yeah. You can hear some sound, right? That's the sound of pressure cooker. No, okay, you're talking in terms of support. Obviously, I presume that even that offers a better support. Right. So, shall we proceed with MCQ discussion, or do you still have any queries? Okay, good to hear that, Bernard. I mean, do you want me to write on board or do you want me to type? Anything is fine for me. If you want me to write on board, I can do that. You want me to type? Okay, fine. Okay, Niharika. Thank you for giving me the choice. Okay, here you have your first question. Failure to replace a missing tooth leads to all except supraocclusion of opposing teeth, tilting of adjacent teeth, loss of proximal contacts, none. So we have 11 questions, 11 fours, 44 with -1 negative marking for wrong answer. So keep that in mind. Just make a note of your score and present that at the end of the session. Okay. Yes, we have an unanimous answer, which is really good to see. So failure to replace a missing tooth can lead to supraocclusion of the opposing tooth, drifting of the adjacent teeth. As a result of drifting, there can be loss of contacts, right? So option D, none, is the appropriate answer. Good. Right, we'll proceed with the second question then. Right. So second question, a cantilever refers to pontic which is attached only on one side, two sides, both, none. Okay. Yeah. So simple question. Right. So we have unanimous answer again. Good. So cantilever refers to pontic which is attached only on one side, right? Good. Right. Let's see. Let's see how many of you are going to give an unanimous answer for this question again. So we have two statements for third question. Okay, let's see. FPD should be designed as simply as possible. That is statement 1. And statement 2 says that a single missing tooth can almost always be replaced by 3-unit FPD with abutments on mesial and distal except for maxillary and mandibular canines. So let me know which is the right statement, or if both are right or both are wrong. Okay. Again, unanimous answer. Good. Maybe it's the start of a week. You're all doing extremely well. Yes, both statements are true. Statement 1, FPD should be designed as simply as possible, which is true. And a single missing tooth, we have this conventional 3-unit FPD, except for maxillary and mandibular canal, where we take the support of mesial 2 teeth, lateral as well as central incisor, right? Yeah. Now, we have fourth question, assertion and reason. Tell me not just whether they're right or wrong. Also, let me know if the statement reason is justifying assertion. So, assertion is long-term prognosis of single abutment cantilever is poor. Reason, forces are best tolerated by periodontal structures when directed in long axis of teeth. So, do you think both statements are correct? And do you think reason is justifying assertion? Okay, we're going to see that. So you mean both statements are right and we have a mixed opinion. Few say it is justified, few say it is not justified. Okay, let's see. Assertion states that long-term prognosis of a single abutment cantilever is poor. Reason, forces are best tolerated by periodontal structures when directed in long axis of teeth. So first of all, as you said, both statements are true. Good, agreed. But what about the reason? Do you think reason is justifying the assertion or not? Okay, let me just put that in a different way. Single abutment cantilever has poor prognosis. Long-term prognosis is poor because there are generation of lateral forces. There can be tipping, there can be horizontal forces, tipping forces, rotation forces, or drifting forces, right? So both statements are true, but reason is not justifying assertion. Reason is true. I mean, the statement as such is correct. Yes, we have better results or better prognosis when the forces act along the long axis of tool. But why do you think cantilever has a poor prognosis? It's because of lateral forces which are being generated, right? So both statements are true, and reason is not justifying assertion. So you have any contradictions, let me know. So who all are not agreeing with me, just let me know. We'll have some fight. So Gina, what does it mean? You raise your hand, what does it mean? You object or you agree with me? Yes, Niharika. The reason is true. The statement as such is right, but that is not justifying the assertion. If the reason is like the prognosis of the cantilever is poor because of lateral forces, that would have been perfect, more appropriate. But here the reasons gives a general statement. It's more or less like a general statement, isn't it? It says that, the tolerance is good when the forces are acting along the long axis. So that can be taken as a general statement, which is true, absolutely. But do you think that's justifying the poor prognosis of cantilever? Cantilever, poor prognosis because of lateral forces, right? It has the same meaning indirectly. Okay, you're objecting. You yourself are giving me the answer. You're saying indirectly, right? Controversial question. Now, what I feel is like along the long axis, that's true, but as such, you can't claim that because of this, you have this poor prognosis for cantilever. I mean, that's my opinion. Yeah, I do feel that reason is true. It's a general statement, more or less, but it's not telling you why cantilever is a failure for in a long-term scenario. It's not telling you why a cantilever has poor prognosis. The reason only says that it's good if you have these forces acting along long axis. Okay, right. Okay, we can go on fighting on this. It's a never-ending saga. Anyways, we'll just proceed with next question. Right? Okay, Ashina, you won this time. Fine. So fifth question. Cantilever is indicated in all except. If at all you get such question, don't worry, you'll be getting the answer whether you mention it as justified or not justified, because you can have your own way of justifying your answer, right? So don't worry. So cantilever is indicated in all except replacing missing lateral incisor, multiple missing teeth, implant supported processes, and option D, none of the above. So cantilever is indicated in all except. Yeah, hi Purvel and good evening. Good morning for you. Right. So we have unanimous answer, which is good to see again. It's option D. Right. Yeah, so we have our sixth question. Which of the following is an ideal abutment? Endodontically treated tooth, mesially tilted second molar, mandibular molar with converging roots. Option D, none. So which among the following is an ideal abutment? I will not agree if you say option D. I am not going to agree. Samshik has changed his answer. Okay, right. Niharika, you say option A. Okay. Okay, then see, how can you change Komal? Sorry, Zina. So Komal says option A. See, which of the following is an ideal abutment? Ideal abutment, ideal case scenario, you'll have only one, right? So ideal case scenario is unrestored abutment. So this is an ideal abutment as per the literature, right? So that's the reason why I'm not going, I'll tell you why I said no. Okay, unrestored abutment is an ideal tool. So the answer is option D. But if you go based on the previous concept of assertion and reason, then among the given options, why haven't you chosen the more appropriate option? Why did you go for option D? It's because you've chosen option D because the question is ideal, isn't it? You haven't chosen the best among the three options. In case of endodontically treated tooth, mesial tilted molar or mandibular molar with converging roots. Among these three options, you haven't selected the better one, but you have gone for option D, isn't it? So which means the question is ideal abutment tooth. So obviously it's an unrestored abutment. And in that case, while going for answering assertion and reason, why did you choose that justified as an option when the reason is true, but it's not justifying? It only states the truth in another way, but it is not directly telling or supporting or justifying the reason, isn't it? What do you think about that? I'm again trying to provoke you. Let's see. Hi Anjali. Yes, I have already done one video on tooth numbering systems. You can refer my channel. You can just check out the playlist there. You'll definitely find one video on nomenclature. Check out the playlist dental anatomy. You'll find a video over there. So that's my point. So that's my point, right? You might not agree, but that's my stand. I might be wrong. Of course, I might be wrong. I can be wrong. Are unrestored teeth are weak? Oh no, we're talking about sound tooth for him. Sound teeth, they're very healthy. They're not weak. You think you're underestimating the power of unrestored tooth for him. Unrestored tooth is very strong. It's vital. I mean, nature has given you with these beautiful structures called teeth, which are very strong. You're able to have your different types of food, non-veg, bones and all. How is it possible that? Okay, so in this question, obviously the question is ideal. So you have selected D. And I just provoked you regarding the previous question, okay? Just leave it. I hope you got my point, right? Yeah. Yeah, if asked, that's a good question, Bernice. Just rule out that option D, just remove that none. If among the first three options, endodontically treated tooth, mesially tilted second molar, mandibular molar with converging roots, which among these would be a better abutment? You just can't compare. Because endodontically treated tooth, it varies depending upon the presence of tooth or which tooth is endodontically treated, depending upon the remaining crown structure, the root configuration of that tooth, and mesially tilted second molar. depends upon the angulation of tilt, depends upon the status of adjacent teeth, opposing teeth. So mandibular molars with converging roots. So if you ask me to choose among these three, I would go for, it's difficult. I mean, each one is so complex that we can't have a comparison, in my opinion, frankly speaking. You want to go with C? Okay, right. Hi, Manas. Good evening. C seems to be better. Yeah, C looks, yeah, exactly, Bernie. Exactly, Regina. That's what I'm about to say. C looks too nice. Okay, Bernice, come on. Don't confuse me further. C would be appropriate, I feel, among the three options, right? So we'll just proceed with the seventh question. I mean, if you can rule out, I mean, again, Reagan is getting confused. Just assume that the previous question you don't have option D. Option D is removed from the question, then among the first three options, which is the more appropriate one. That's what I said, Bernice. As I said, I mean, there is no point in comparing, frankly speaking, because it depends on the case, it depends upon the status of tooth, then it wouldn't be wise enough to have the comparison between altogether different kinds of situations here. But it's mentioned that in literature we have an ideal case scenario, so based on that, I've designed this question. That's it, right? Okay, we have two statements here. Okay, come on. The answer to the previous question is option D, none, right? None. Okay, Regina, accepted. Yes, Ashina, to the question which Bernice asked among the three options, C seems to be comparable better, but we just can't have this direct comparison, right? Okay. So seventh question, oh, you already have answers for it. So statement one, orthodontic wire can be used as a simple stabilizing appliance to prevent drifting. Statement two, simple stabilization prevents supra-eruption of teeth as well. So let me know which statement is true and which is false, or whether both are true or both are false. Yeah, please keep on answering the question. In the meantime, I'll just type out the next question. Next question with options. Right. So, previous question statement 1, orthodontic wire can be used as a simple stabilizing appliance to prevent drifting. Yes, that's true. We have given a clinical picture where they have placed an orthodontic wire extending from two teeth onto the ridge, right, to maintain the space, to prevent space loss. So statement 1 is true. Statement 2 states that simple stabilization prevents supereruption of teeth as well. It's false. Simple stabilization only prevents drifting and prevents loss of contacts, but doesn't prevent supereruption from happening. Supereruption does happen. So statement 1 is true and statement 2 is false. No, for him, stabilization is different. I mean, stabilization is something which helps in maintaining, right? Stabilization is not just splinting of teeth, even that comes under stabilization. But here we're talking about stabilization in terms of maintaining the space, maintaining the edentulous space between two teeth, right? Yeah, we'll have our next eighth question. So that's pertaining to Anti's law. Right. So Anti's law states that perisymmetrical area of abutment teeth should be less than that of teeth being replaced. Option B, perisymmetrical area of abutment teeth should be equal to that of teeth being replaced. Option C, both. Option D, none. So this is pertaining to Anti's law. Right, so this is quite interesting. We have again a mixed opinion. Anti's law states that perisymmetrical area of an abutment teeth should be less than that of teeth being replaced. Option B, perisymmetrical area of abutment teeth should be equal to that of teeth being replaced. Option C, both. Option D, none. So today it appears to be like more of controversial questions, right? So maybe it's Sunday yesterday, so I have more of rest, as a result of which we had these kind of questions today. Okay, so is it option B or option D? So if you observe the definition, I mean, Rosenstiel, they have mentioned that perisymmetrical area has to be greater than the teeth which are being replaced. But GPT definition, glossary of prosthodontic terms, the definition says that the perisymmetrical area of the abutment teeth should be equal or greater than that of teeth which are being replaced. Right. So obviously it is option B. I hope it's clear. Any contradictions, let me know. Yeah, just give me 1 second. The charging is low. Just give me 1 second. Height of it. Right, so you all agree with me, right? So it should be equal or greater, right? So option B is the right answer. I hope it's clear. Yes, Regina, what's your doubt? Superapposition we see when we don't have an antagonist, right? Yes, that's what we're saying. In case of missing tooth, you'll obviously have supereruption. And this simple orthodontic appliance is not going to prevent that supereruption from happening. Exactly, Mega. According to GPT, it is equal or greater. Yes, Ashina, I didn't get you. What can we do? Sir gave us only half the statement. You're talking about the textbook discussion, right? Yeah, in the textbook discussion, I haven't mentioned this. That's the reason why I mentioned it here in the MCQ. See, the purpose of the entire session is to give you information as much as possible. Textbook discussion, what's there in the literature, I'll be discussing that as much as possible. But I found that the definition is different compared to that given there and the GPT, and that's the reason why I incorporated the definition, the question related to this anti-slow here, right? Okay, right. We'll just proceed with, I mean, we have final 3 more questions. We'll just do them as fast as possible. Okay, Ashina, I'm sorry. I didn't, that's why I didn't get you. I mean, so when you come in, if you're addressing to someone, just type it at Regina or at someone, right? So that dumb people like me will not get confused. So we have another question. Let's see how it's going to happen. Sorry, I have no intention to conduct or organize another midnight session, but because of the volume we have here, it's taking more time. But definitely, I feel it's worth. Obviously, you have to feel that, not me. Yes. So we have our 9th question. Better support is anticipated in molar with converging roots, single rooted teeth with a circular cross section, both A and B, option D, none of the above. Yes, Ashina, Neetu, Prithvi, Dimple, Gina. Yes, Komal. Good, Komal. You're doing great. Mega. Yes, Preeti, Bernes, Lavanya, Srish, Anobali. Yes, Nikita. Yes, Farheen. Exactly, Neetu. Diverging elliptical are best. An upright tooth compared to tilted teeth are best. Yes, Prithvi, Niharika, Tanu, Parveen. Right. Yes, Pooja. So better support is anticipated in none of the following. Right? Option D is more appropriate. Yes, Ashutosh. So we have our penultimate question. Hi, Toffee. Hmm? Toffee. 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 Yeah. Okay, Regina. Good night. So we have a 10th question. And glad to hear that, Bernice, Prithvi. So considering all other factors constant, if FPD with single pontic deflects 10 units, FPD with 2 pontic span and 3 pontic span deflects option A 8 and 27 units, option B 80 and 270 units, option C 800 and 2700 units, option D 8000 and 27,000. It's not 2700, it's 27,000. So which among the following is the right answer? Oh my god, we have all the options D, C, A, D, B. Come on. Yeah, don't get confused. Okay, before answering, just remember, as I said, deflection is proportional to cube root of length. So, one pontic length, if it changes by x units, two pontic length changes by 8x units, three pontic length changes by 27x units, and so on, right? So in case of one pontic, the deflection is 10 units. So two pontic, it has to be 8 times 10. Three pontic, it has to be 27 times 10, and so on, isn't it? So what should be the answer? 1 Pontic, 2 Pontic, 3 Pontic, 4 Pontic length, the span of the bridge. It changes by 10 units. So as we discussed earlier, if it changes by x units, 2 Pontic changes by 2 power 3, because as I said, deflection is directly proportional to L cube of length, right? So 1 Pontic, if it changes by x units, 2 Pontic changes by, the deflection would be 2 cube, which is 8x, 3 Pontic, 3 cube, 27x, 4 Pontic, 4 cube, 4, 4, 16, 16, 4, 64, 64x. So the longer the length of the bridge, the greater the reflection, and this relation is not linear, it is in this format, deflection proportional to cube of length, right? So substitute the value x with 10, where I've given the value as 10 units. So x is 10, 8x, 8 into 10, 27 into 10, 64 into 10, and so on, right? That's just a model for you. So the right answer is right. I hope it's clear now. So it's option B. Okay, when we go around with this, you say cube thing, and also you multiplied that by 8 and 27. Okay. Right. So we have a final question for today. Right? So I think it's better if I can make a note of it. So final question, I'll just write it on board. Okay. Okay, you're welcome, Anu. So 11th question, it's matching. So you have two columns. The first column represents a clinical scenario. The second column, treatment option. Okay, we have two columns. Single missing tooth, missing lateral, missing canine, tilted molar. And here you have 4-unit FPD, with non-rigid connector, 3-unit FPD, cantilever FPD, right? So here you go. So we have two columns. The left one represents a clinical scenario and the right one represents a treatment option. So match the following. Left side you can see single missing tooth, missing lateral, missing canine, tilted molar. The right side you can see the right column, 4-unit FPD, FPD with non-rigid connector, 3-unit FPD, cantilever FPD. It's 4, I'm sorry. Yes, Prithvi. Yeah. I think I'm standing on way. Right. Yes, Bernice, thank you. Exactly. By the way, Rishabh, I hope you've gone through the explanation which I've given you initially. So in case of missing maxillary or mandibular canine, we go for anterior two teeth, lateral as well as central incisor. Right. Okay. I just wait for a few more minutes. So try to complete off as soon as possible and project your scores as well. Yes, Ashutosh, very good. Preeti, Rishabh, Megha, Ashina, Preeti. Yes, Komal. Yes, Bernice, Lavanya, Dimple, Srish, Enoguli, Farheen, Gina, Nitu, Niharika. Yes, Anu, good. Right. So as you can see, a single missing tooth, a conventional way, we go for 3-unit FPD with, abutments on either side, retainers on either side of abutments. So A3. Missing lateral, so obviously we take the support of canine, so cantilever design. So B, we go for 4. So A3, B4. Missing canine, so we go for lateral as well as central. We take 2 abutment teeth as support anteriorly, so 4-unit FPD. So we take 2 teeth mesially and 1 teeth distally in case of missing canine. So C1 and tilted molar, we go for FPD with rigid, non-rigid connector, or we can even correct this tilting, or we can even go for prevention, right? So we have different options altogether. So A3, B4, C1 and D2. Right. So I hope it's clear and I hope this session has been of some use to all of you. So again, we have a lot many topics to be covered this entire week. So we'll be having these live sessions as usual. And we'll try to start on time and also we'll try to complete on time as fast as possible. Will not take more than 1 hour or 1.5 hour maximum, right? So I'll try my level best to do so. And hope your preparation is going on fine. So we're almost approaching. It's less than 2 months, I feel. So 35 days to 45 days. So make maximum use of the time. In case you feel demotivated, demoralized, just leave me a message. I will take care of you, right? So give your best and be positive, be optimistic, not just optimistic, but dangerously optimistic. And you're going to do the best. I hope you've taken a soft copy or at least a printout of the rank card, model rank card, and write down your name. I even got some mails saying that, sir, we have done this and this is what it appears. So if you wish to, just write down your name on it and then send that copy to me also, right? So wish you all the best. You have any further questions, you can drop them at proudtobedentist@gmail.com, right? Yeah. Good night. Take care and love you all. Scores. Yeah, I'm sorry. Yeah, of course you can give scores. I'll wait for a few more minutes. Yes, Pooja. Yes, yes, drop your scores and then leave. Yes, Komal, thanks for reminding. It's been 11:50. You can sleep by 12 and you can wake up at 5. So 5 hours of sleep, and you can compensate that in the evening session. 5 to 6 a.m. or 5 to 7 a.m. and then you can proceed accordingly, right? Yeah. Yes. So Neetu, 44 out of 44. Excellent. Lavanya, 34. Very good. Well done. Yes, Gina, 29. Good. Ashina, 40. Yes, yes. Of course, you will get marks for it. Good, Ashina. Yes, Srish, very good. Perfect, Preeti. Mega, 29. Good. Yes, yes, good night, Preeti. Right. That's it. Only 5 or 6 of you gave you the scores. Yes, Komal, good. 39. Impressive. Yes, Preeti. Good. 39 out of 44. Yeah, no, just send me a mail. I'll send you the dummy rank card of last year's. You can just write down your name and then you can stick it on wall. Yeah. That's it. We have only few scores. I think all of you are sleeping, I guess. Toffee. 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 Big baby. It's big baby. This guy is reluctant to come. I don't know why. Say good night. Yes, Ashina, there are 11 patients total. And tomorrow morning, we're not having any live session, Komal. We'll be having morning live sessions only on Thursdays and Fridays. Okay. Yeah. Toffee, say bye. Say good night. Good night. Okay, Ashina, congrats. Good, well done. Keep the momentum going, right? See you again tomorrow in our next live session. Yeah. Yeah, yes. Good night from Toffee side as well. Bye. Take care.